You have diabetes and heart disease, struggle with depression, and feel overwhelmed by the constant regimen of pills, tests, and medical visits needed to treat your illness. Even getting a simple meal on the table for your family is a challenge. Today, your doctor gives you a referral for a colonoscopy, but you have no car, no child care, and no money for the copayment. You decide to skip the colonoscopy. In the city of Buffalo, the burden of living with chronic disease is a major contributor to the health disparities that affect our community. The burden of day-to-day care often takes priority over preventative care, such as cancer screenings. As a result, cancer is all too often diagnosed at an advanced and less treatable stage.
Patient Voices was a project that's funded by the National Center for Minority Health and Health Disparities. And the idea of it was to bring together practice sites and community-based organizations, as well as their patients, to design interventions that are practical and acceptable by the patients and the providers to improve the overall delivery of care.
I'd like to see more information out in the community about colon cancer, and I'd like to come up with a solution that will make them interested in it.
Like for the colonoscopy, for instance, a lot of people scared to take them because they don't know what's going on. They think if I would take colonoscopy, oh, they got cancer. It's not like that. It's to make sure you don't.
The two practice sites that we worked with were Jericho Road Family Practice and Jefferson Family Practice. Both sites are located in Buffalo. Jefferson is on the east side of Buffalo, and Jericho Road is on the east and west side. There's two sites there.
We've learned a ton about what works and what doesn't work, and what we would want to do going forward, and just having the resources and the Patient Voices staff kind of offer to help in any possible way has been a huge benefit and a blessing to our work.
I don't think I understood how it impacted people not to understand what was there. And now I'm learning, that it's a bigger picture. There's more people out there who need help. I understand that there's more needed to be done.
It brought people in the community together, get to know more people and some problem that they had might have had, and ways to solve them. So it was, and fun too.
The information that I get in here, I usually tell some people that I know are my church members, and I tell them. If I stand and talking to somebody on the street, a lot of people ask me a lot of stuff, and you get information out like that.
They went and checked in to see if your insurance can get you there for free. Some people are older, and need some help to go in. And even if we were sent out for a test, they took it a step further to find out we can make this procedure smoother for you. We can probably provide a ride and see how long this test is going to take. If you need somebody to be there with you, all these things, and it made it easier for the patients just by listening to me.
It seems like the way that we're going to improve and impact the quality of care is through non-clinical setting visits where you engage with the community, kind of try out what community health workers would look like, especially based on a specific condition. I think among the patients we serve, we have language barriers. We're an unusual practice. Less than 50% of our patients speak English as a first language, and probably 40% don't speak any English at all.
We actually took a step back, and we worked with, along with Jericho Road Ministries, the Hope Drop-In Center, and the practice sites to learn more about the refugees, particularly the Iraqi, Somali, and Karen populations that tend to be the largest populations here right now, to learn more about what their experience is with cancer and cancer screening from the countries that they came from, as well as what they've experienced here now that they've been in the States for a little while.
One of them said the cancer is one of infection diseases, and the other one said we can't get the cancer by touch anybody, or from the air like viruses. So I believe they need somebody to educate them, because they don't know a lot. Misinformation about this disease, especially the cancer.
You know, if you got 10 people, and out of that 10, if you can save 2 of them, you know, you're doing good, you know. But instead of trying to save the 2, we want to try to save the whole 10.